Good morning. My name is Aditya Nair, and my today's topic is diagnosis of peripheral arterial disease. So, what is actually peripheral arterial disease? Peripheral arterial disease is a clinical term that denotes an occlusive disease arising from narrowing of the arteries distal to the arch of aorta. So actually there is narrowing of the arteries, right? So this particular narrowing can lead to the blood supply being disrupted, right? So it can cause various other problems. Okay, this leads to peripheral arterial diseases, as you can see in here. This is a normal blood vessel and this is a blocked one, partly blocked blood vessel. This can be due to atherosclerosis. The other name of peripheral arterial disease is atherosclerosis obliterans. So the risk factors which leads to the risk factors of peripheral arterial diseases are age. As the age increases, you are more prone to the peripheral arterial diseases. Smoking. Smoking because this tobacco has a substance called nicotine. This nicotine gets accumulated in the blood vessels and can cause the peripheral arterial disease. Diabetes can also lead to peripheral arterial disease. Hypertension and then hyperlipidemia, the main cause of the peripheral arterial disease, because high level of cholesterol can lead to plaque formation inside the blood vessels and can lead to peripheral arterial diseases. And family history, if anyone in your family has, then next is examination. So we have various examination that involves palpation, inspection, and auscultation. So inspection is of feet, that you have to inspect inspection of feet, and in presence of rest there will be pain. The feet and toes will be cold and purplish. Why? Because there is lack of blood supply. That's why. Palpation of limbs distal to obstruction, which will appear cold to touch. Whenever you touch the patient's limb, like foot or toes, you will feel they are cold, right? Next is another palpation involves of the abdomen to rule out any type of aneurysm of the abdominal aorta. An auscultation of the abdominal aorta, iliac arteries to reveal stenosis. Okay, this can reveal stenosis. Stenosis means narrowing of the arteries. Okay. Next is investigations. Investigation includes ankle brachial index. Ankle brachial index under normal conditions, systolic blood pressure in the legs is slightly greater than that in the upper limb. The ankle brachial pressure index calculated from the ratio of ankle to brachial systolic pressure is a sensitive index of arterial insufficiency. The highest pressure measured in any ankle artery is used as the numerator of the index. A value more than 1 is normal and a value less than zero point 0.9 is abnormal. Okay, that is what is ankle brachial index. Ankle and the uh, brachial pressure index is calculated, and if it is more than 1 then it is normal. If that is less than 0.09 then it is abnormal. Second is exercise test, which is performed by exercising the patient for 5 minutes, say on a treadmill, right? And the ankle brachial pressure index is measured before and after exercise. A pressure drop due to peripheral vasodilatation of 25% or more indicates significant arterial disease. Like, you're going to take the patient, ask him to do exercise for at least 5 minutes, like on a treadmill or for cycling or some type of strenuous exercise you're going to give, and you are going to check the ankle brachial index before and after exercise, and if the pressure drops by 25% or more, then it indicates arterial disease. Third is ECG for the evidence of ischemia, if there any type of ischemia is present or not. Fourth is angiography to define extent of disease, how much the disease is, how much it has affected, and possibility of bypass surgery or endarterectomy. Like if any type of bypass surgery is needed, and if needed, how much the patient can survive. Specialist diagnostic and therapeutic devices like pressure wires with built-in pressure sensor at the tip to measure translational peripheral gradients to determine hemodynamic importance. Intravascular ultrasound for lesion assessment and for optimization after angioplasty or stenting. Like after surgery, you have to check how much the lesion is or how much it is there, if it is present or not, like that. For that, intravascular ultrasound is used. Specific atherectomy device to debulk, slice and remove plaque through long segments of heavily calcified lesions. Excimer laser technology for endovascular ablation for total occlusions. Reference is taken from Golwala's Medicine for Students. Thank you and have a nice day.